Hi, my name's Tim. I just thought I'd make a YouTube video. 6.5 days ago, I had bypass surgery, which was a triple bypass on the heart. It all happened, I was on the waiting list for about 6 months. I was sort of just feeling very breathless every now and then, particularly at work, everything like that. And so I decided to see my GP, and she wrote out a thing called what's called a calcium score. And I had the calcium score done, which is sort of like a quick scan, but it's a really good scan because it shows arterial blockage, and mine was absolutely really high when it came back. I didn't find this out for about a week and a half. I didn't get any phone calls or anything. I don't know why, but usually bad news is always delivered very fast. But in my case, what the GP phoned me, I assumed it was okay, and a week later the GP phoned me and said it was off the charts. It was 420 or something, which is severe heart disease, when it should be only 11 or 10 or something for a 51-year-old man of my age. So I found myself a good cardiologist after that, and he asked me whether I wanted to go for bypass surgery. He told me they won't be able to stent them because it's too scattered in the arteries. So then I got a thing where I had an angiogram where they put this wire up you to see the blockages, and they confirmed them. There was 70% block in the left anterior descending artery. The circumflex was 90% blocked, which was pretty chocked. And the right coronary artery was 70%. But it was all scattered along the pipeline. So because stents compromise the heart muscle, I'd have to put too many stents in, and it would be so bad on the heart, and it just wouldn't be medically viable, right? So I went on the waiting list under a lot of medications for about 5 months. I had one to slow the heart down. I had double blood thinners, which always made me feel pretty tired. Although 5 days before the operation, they take you off the double blood thinners to avoid the blood, so the blood can clot a little bit easier. Otherwise, it's too thin, it can just leak and you can lose blood easier. So I was on a single blood thinner, double blood thinner. I was on something to slow the pulse down, because my cardiologist's theory is if you're living and waiting for an operation with blocked arteries like that, there's less risk of a heart attack by keeping the heart rate a little bit slower. So all of these medications, and I was on Repatha, which is a clickable injection to stop bad cholesterol, or the liver producing bad cholesterol. And I had a test, and there's a history of heart attacks on my dad's side of the family, my father's, and I found out I was in that vulnerable part. So my LDL cholesterol was really bad in the genetic carrier. So the Repatha is actually treating that. The injection called Repatha is treating that. And I'm still on it today. Although just coming out of hospital after the bypasses yesterday, I'm now back at my sister's place in Perth, where I'm going to stay for about 7 days, because I live in the country, and if I go home to the country and something goes wrong, right, and there's no good doctors, well, my life could be in jeopardy. So it's always good to be close, and they recommend anyone from the country to stay in the city for at least 7 days after the bypass if you don't already live here. Lucky for us, we're only minutes away from Charlie Gardner Hospital, but so far so good. I slept very well last night. I ate my breakfast this morning, sticking by all my medications, and I feel generally pretty good, actually. I went for a short stroll this morning in the sun. By God, it was just so good to see the sun after a whole dull week in hospital. You know what hospitals are like, where you can rarely ever see the sun. It's very, very hard. I got in there about a week ago. It was pretty weird. They took me to, I went there early. I didn't actually go the day before. I went there at 5 a.m, and I waited around for a little while. Then they got me ready, and they shave you down. I had to bathe, or shower rather, in this antibacterial soap, before the surgery, and use a few nose drops to protect against nose germs. I did all that. They shaved all my hair down. I went into the operating theatre. I remember vaguely them wheeling me into the operating theatre, and I saw this big light. It was a big round light above me, and up come the surgeons. So I'm moving some machines closer to me, and after that, there was none. There was just nothing after that. I can't even remember them saying we're going to count to 10 to, that test when you have anaesthetic and you count to 10, and they just see whether you can count to or get past 2 or get past 3. I can't even remember that. All I remember is waking up next in ICU, and I was just yelling out. I was saying, "Water! I need water," because I was just so dry. My whole mouth just felt like it was just skin. There was just no suppleness in it. I found out later that part of my lung collapsed during the operation. And then I heard the nurse saying, "His hands are so cold." Normally I've got really warm hands, but when she said that, I was very sore, but I reached with any energy I had and I touched my hand and it was cold. And I looked it up in Google and I found out later that cold hands can usually be low blood oxygen. So because I was told later after the operation, there's a little bit of fluid in the lungs from a collapsed lung, but luckily for me, it wasn't a severe collapse. A severe collapse can cause danger during the op, but mine was only mild, but it was enough to just make my hands cold. So yeah, and also I was told I had pericarditis after the operation, and by God, I could feel it. It was like someone was burning a 50-cent, I'll just film where it is, a 50-cent coin in this part of the sternum. It just burnt and it burnt and it burnt. And I just got these terrible electrical burning shooting pains, like I was having a heart attack. It was awful. Breathing was so much harder. This was immediately after the operation, and when I was wheeled out of ICU. Later on, I found just before I left ICU, the doctors come in very concerned, saying, "Mr. Cooper, it looks like you have a bit of pericarditis." And I was like, I was still a little bit out of it, but I said, "Is that serious?" And they said, "Well, yes and no." And I tell you what, that wasn't a good enough answer for me, because I wanted them to say no, obviously. But luckily, I'm out now. A couple of days before I got out of hospital, the walks were so hard. I remember walking one flight of stairs and I was exhausted just after a few steps. That was obviously explained by the collapsed lung and just laying around so long in a bed when I was very active and fit. I was actually very fit before the operation, but it slowly started getting better. They sort of, when anyone has a bypass, they take fluid. They have two little drain pipes sort of just above the belly button. And I remember looking down just in ICU before I came out, and I saw a bucket and it was full of all this blood, like blood and water. And they told me that's all the fluid and stuff that's drained out. So obviously that came from the collapsed lung. So they got quite a bit of fluid out of there. So it must have got rid of the collapsed lung, because I'm good now. I've actually, on discharge, they put me on medications to remove any excess fluid that may still be stuck there in the lungs. I can breathe in like that really hard and good now. So I think I'm breathing really well. And the sharpy sort of pains around the heart, they're more or less very, very reduced now. Although not long ago, I felt the knifing a little bit there again, a few electrical things from the pericardium, but I can just tell that they're more or less healing themselves. So they put me on a medication on discharge that's supposed to heal the pericardium from its inflammation, they told me in hospital that there was an irregular ECG that they found after when I was in ICU, because the pericardium, where they stitched it, was all inflamed and the heart muscle was hitting the chest and frictioning on the pericardium. So that resulted in a regular ECG, which is normal for pericarditis it's called. So a little bit scary, very scary. And by God, I had all machines hooked up to me when I got even back to my ward. They monitor you on the cardiac ward as well as ICU. And I could hear jumps all the time. I looked over my shoulder because I was still very weak. What I was getting was called PVCs, or what's it called? PVCs, pre-ventricular contractions. That means when your heart's beating normally, the pericarditis was causing the heart to jump a beat that was too early before the firing of a normal ECG or a normal heart rhythm, which isn't a problem, but PVCs can be dangerous if they go for a very, very long period, but I've only just started receiving them, right? The PVCs obviously were there, and I could feel it. When I was laying in the hospital bed, I'd suddenly almost jump like that because I just feel a boot in the palpitation in the chest, and that was obviously from the PVCs. And when I felt the pain and the boot from one of them, I'd hear the machines go really silly. So yeah, so that was really weird. But that's all settled down now. I'm on lots of medications and generally feeling a lot better. And like I've read, PVCs aren't serious if they're just in the short term, and hopefully mine will all but go. So it's a bit of a scary thing, but lucky I haven't got the worst of things like atrial fibrillation or anything too bad. So yeah, okay, so I'll just leave it there. This is Tim Cooper. This is 1 week after cardiac surgery. I've just gotten out of hospital, so I was just going to make a video of how I'm feeling. I'm feeling quite good. I'm on a lot of pain medications. If I don't take them, I feel a lot more pain back there again, but they seem to be keeping me really well. Just today, the skip beats and the jumps of the heart, or the PVC, seem to be a lot better. The pericarditis seems to be fixing itself. Hopefully my heart isn't too wounded. They said to me that, I asked them that question on discharge, and they said your heart shouldn't be wounded because PVCs aren't a dangerous form of irregularity and they should subside. And the pericarditis on the heart, which is the pericardium, the layer surrounding fibrous layer they cut around, the surgeons stitch it back up after the surgery, and in my case, mine inflamed. So yeah, hopefully when I make my next video 3 weeks after surgery or 2 weeks after surgery, I'll be not 100%, because bypass surgery takes up to 6 months for people to get better, right? I can't drive for another 5.5 weeks as it is. Yeah, hopefully I'll be feeling a lot better by the next video, but I feel generally good because the painkillers are keeping me pain-free. I'm eating well. Even in hospital, I ate all my meals. I was very fit going into the operation. I used to walk about 10 kilometres a day, and I kept very active. So it was just the pericarditis issue and the PVCs, and the pericarditis was causing pre-ventricular contractions, which was a little bit of heartbeat irregularity, but that seems to be getting a lot better now. And it hopefully hasn't impacted any damage. And yeah, so I'll make my next video perhaps in the next 2 weeks or week. So if anyone's going through this type of operation or about to have it, I just thought I'd make today's video just to give you an idea. This is my story. You know, if you're watching it and you've got to have a bypass, mine was a triple. I'll just show you where they took the radial artery. You can see a big meaty scar. It's taped up, but they actually hunted a huge vein out my arm. I didn't have any taken out of my leg for the triple bypass, but they hooked up the left mammary artery, which is right near the left part of the heart, and the right mammary artery to the other one that needed bypassing. And yeah, I looked it up and Googled it, and they said it's very ideal to use the mammary arteries because the mammary artery hardly ever needs redoing again. It's generally a really durable artery that never ever blocks, so you'll always probably have good blood flow. So yeah, absolutely. Hopefully mine will serve me for a very long time. And also the radial artery in the arm's meant to be even better than the leg artery. So the cardiologist that done mine with the radial artery in the arm obviously knew what he was doing, and he's chosen the very best veins. Yeah, but just concluding, I don't want to scare anyone. I mean, the PVCs I experienced and the pericardium issue, which was a little bit of a concern, might not happen to you if you have a bypass, whoever's watching that has to have one. I mean, even if they do, I've found I've gotten over mine really quickly. I mean, there's so much they can do these days that you mustn't panic if you get an issue like that, because there's so much more they can do, and that's what I've learned. I was a bit terrified when I was in hospital when I found out I had the pericarditis and the doctors looked concerned. Well, naturally you'd feel terrified, but that's how I felt. But here I am, and I've survived it all, and I'm doing well, and I'm on simple medications to help the pericarditis, and I should have a really good heartbeat in no time. Yeah, okay. Thanks very much, and I'll make my next video in a couple of weeks. So yeah, like I said, this is just a video to let you know if you're going to go through triple bypass surgery or any type of bypass, single, double, what you may expect. But I'm doing well. Bye for now.